Coronavirus especially concerning for people with compromised immune systems. Our Joel Hillen talked to a doctor about how patients can deal with this outbreak, and Joel, still so many questions surrounding this.
Yeah, Dominic, the doctor says what's so difficult about this is the fact that we don't know a lot about COVID-19 right now. But his message to his patients has been consistent, as well as his message to the rest of us.
What we know from the data from China is that 80% of people who get infected with COVID-19 have a very mild or moderate illness that doesn't require hospitalization.
Dr. Thomas Campbell has spent the last 3 decades as a professor of infectious disease at the University of Colorado. He cautions people not to rush to the emergency room at the first sign of symptoms.
It's not necessary for most people with COVID-19 to come into the hospital. If people aren't sick enough to be in the hospital, if they can manage their illness at home, keep themselves away from others until the illness resolves, then that will help protect the people who have to be in the hospital, people with cancer and other illnesses that are more susceptible.
Dr. Campbell also works in the CU Cancer Center, where his advice to patients is simple.
It's important that people with cancer or other chronic illnesses be vaccinated for influenza and take these precautions to protect themselves not only from COVID-19, but from influenza and other respiratory illnesses that circulate this time of year.
Dr. Campbell says that the symptoms you should watch out for in yourself are difficulty breathing. If you're having a hard time getting that breath, that's an excuse to go to the hospital. Otherwise, it's best to just ride it out at home. Live in Denver, Joel Hillen, covering Colorado First.
Some simple tips, but man, are they important, Joel. Thank you.